Congressman Richie Torres of New York. Congratulations on not having flight delays. Congressman, what are you going to do? Are you going to vote yes on the bill as it stands tonight, or do you have reservations like some of your colleagues over in the House?
Of course I have reservations. It's a huge piece of legislation. The thing I look mostly, though, is how it affects Tennesseans. And if it doesn't pass, then Tennesseans will automatically have a pretty substantial tax increase, as in his district as well. So that working folks, things like that, the credits that are there in there for manufacturing, I like the border security. I like the Iron Dome if it's done.
Yeah, but a lot
properly.
of people in Tennessee get Medicaid and SNAP benefits as well. Are you worried about
no,
those cuts?
I'm not, because unless they're doing it illegally and waste, abuse, and fraud. That's all the cuts are. That's a misnomer. That's what the left is putting out to scare people, and unfortunately, that's what we do in politics, and it's wrong.
What do you're saying? Only people who get Medicaid illegally are going to be affected by these cuts? I don't think that's all right. I mean,
I do.
The projection is it's 12 million people. Are you saying 12 million people are getting Medicaid illegally?
And I've delved into those notes, and most of them are unsubstantiated. That's, they will not address the fact that illegals are on it. They will not address the fact that there's a work requirement, which I think every American, if they're capable of working, they should probably not be on Medicaid. And so, we've got single moms, 2 kids or something like that. No, they should qualify for the programs. But if we're not careful, we will destroy the program, and it will not take care of the least amongst us.
Congressman Torres?
The Republican Reconciliation Bill is a tragedy for America. It's a tragedy for the working people of America. The independent, bipartisan Congressional Budget Office has said that it will cause 12 million people to lose their health care. It will slash Medicaid and children's health care by $1 trillion, which is the largest health care cut in recent American history. It will slash SNAP by $300 billion, the largest food assistance cut in recent history. It's going to add $3 to $5 trillion to the debt, plunging our country into a debt spiral. The legislation is a catastrophe. And if you think that $1 trillion cut amounts to preserving or protecting Medicaid, then I have the Bronx River and the Brooklyn Bridge to sell you. It's a lie. Donald Trump is lying about the impact of the legislation to the American people. It's one thing to defund health care and food. It's something else to lie to the American people.
You talked about your reservations, and one thing we've heard from Republicans is you want to get rid of waste, fraud, and abuse, right?
Correct.
Are you comfortable then with the provision that the Senate put into this to get Lisa Murkowski to vote for it, where basically states that have the highest level of erroneous payouts of SNAP get a delay here? Essentially, those states that are the worst at paying out SNAP benefits or do it the least effectively get a delay here, and essentially of how long they could see cuts to those provisions. In terms of that, we've heard from some Republicans who say it's kind of this perverse incentive that the worse you are at this, the more you benefit from this provision in the Senate bill.
I think it allows states to get in line, but also I think it's very disingenuous when you say that it's going to add $3 trillion to the debt in 10 years when the last 4 years.
I didn't say that. The Congressional Budget Office.
The Congressional Budget Office is not nonpartisan. 85% of the people that work in their health care division are Democrats and have contributed to Democrats. Their number one economist.
It's run by a Republican.
Is a Democrat.
It's run by a Republican.
It needs to be disbanded. It is a relic. But the truth is, under the last 4 years, every 100 days we've run up $1 trillion, and all of a sudden you hear the Democrats and Chuck Schumer saying over the next 10 years it's going to round up $3 trillion. Well, where were they the last 4 years when we ran up over $12 trillion in debt? That just doesn't figure, and they're allowed to do that because their mouthpieces in the media continue to tout these lies that they say, and they just don't fit into the real math. And the CBO has never been by a nonpartisan organization.
Okay.
Nobody believes that. Nobody believes that.
Well, the guy who runs it donated to a Republican and is a Republican. But can I ask you on terms of what you're saying about, I mean, you're saying what the media is saying about this is Ron Johnson who had these concerns, Josh Hawley who had these concerns. Tom Tillis is saying people in his state who are deserving of Medicaid would be kicked off.
Outside of Tillis, they all voted for it.
Well, they still criticized it, though, and said they had serious reservations about it.
Well, sure, you're going to have criticism of it, anything that's this large. That's why I think we need to go back to what we do in Tennessee, single-issue spending bills, and let every bill be accountable to the voters. But we don't do that because neither party has the guts to do it, and they know it's a wink and a nod to stack these things up with a lot of pork. Unfortunately, We don't have that luxury with this because of our economic situation that we're in. And I think that the American economy has suffered the last 4 years, and under this bill, I think it will correct a lot of those problems.
So it sounds like you're going to vote yes on this.
I'm leaning in that direction. But yeah, but I still have my concerns. I met with Treasury today over a lot of the issues that I had.
You're leaning yes. I know House Democrats met tonight. We keep hearing the criticisms from Democrats over this bill. I think the question is, what do House Democrats plan to do about it? Are you just going to try to delay it, or what is that going to look like?
We're going to do everything we can to delay it, but there's several factual inaccuracies. So first, federal law prohibits undocumented immigrants from receiving Medicaid. Second, this legislation will destroy far more work than it actually creates. Like healthcare is 17% of the U.S. economy. There are thousands of counties where the largest employer is the local healthcare provider, is the local hospital. And if you drain the system of $1 trillion, it's going to lead to higher rates of unemployment. And then on the work requirements, experience tells us that work requirements are effectively paperwork requirements. It will not lead to more work. It will lead to more paperwork. Arkansas had a work requirements program that caused 18,000 people to lose access to health care. The majority of those people were working people who were eligible for Medicaid. So experience tells us it will not boost employment. It will simply cause people to lose their health care.
What did you make of what Senator Murkowski said today after she was the deciding vote here that allowed Vice President Vance to come in and be the yes? She said that it's been an awful process. She called it a frantic rush to meet an artificial deadline that has tested every limit of this institution before sending it back over to the House.
She described it as agonizing to vote for it, but it's going to be more agonizing for the 30,000 people who lose health care in your district, or the 15,000 people who lose SNAP in your district. It's going to be agonizing for the millions of people who are going to lose food and health care simply to fund tax cuts for the top 1%. I have constituents who, after paying all their bills, live on $20 a day. And we're going to slash health care and food for those living on $20 a day to fund tax cuts